This is the best way I can describe what it's like to deal with the cost of healthcare in America. It's like every ailment that you're dealing with makes you do this return on investment calculation in your head of like, how much is this thing really bothering me versus how much is it going to cost to fix it? And most of the time you're just like, the cavemen survived and they didn't have doctors. So I'll probably be fine. It's like you get into your car and there's a bunch of service lights that come on and you're just like, I'll probably still make it to work. It's fine. Today I hurt my thumb playing basketball. Pretty bad. Like, I think it might be broken and I'd like to get it fixed. But do I want to get it fixed 4 paychecks worth? I mean, how much do we even need thumbs?
Do you want to know how bad healthcare is in America? Here's how bad it is. I get stitches, cut my finger the other day. Go into the hospital, get my stitches done. No big deal, whatever. I have to wait 2 weeks to get them taken out. In the meantime, I get billed for my visit. Before insurance, for 5 stitches, $3,800. After insurance, $1,800. Or $1,900, excuse me. After insurance, $1,900 for 5 stitches for a terrible hospital visit. Anyway, fast forward, so I get my bill and it's time to take the stitches out, so I schedule an appointment at the urgent care that is associated with the hospital that I went to, same company. So I schedule suture removal appointment online, and then I go in for the appointment and they say, sorry, we're not going to take those out. Since you got them done at the hospital, you have to get them removed at the hospital. I said, why didn't you tell me that when I scheduled the appointment online? They said, sorry, go to the hospital. So I go to the hospital. And then I wait around for a while in the ER, and then I get back and I ask the nurse, hey, this is what happened. They turned me away at urgent care, told me to come here, that you guys would do it for free. Is that true? And the nurse said, let me check on that. I'm going to check with billing really fast. So they go check on billing, and then they say, sorry, billing says that you'll have to pay to get these stitches removed. And I said, that really sucks because I paid $1,800 to have that done after insurance. And they said, that is absolutely ridiculous. And I said, I know. And then I said, gonna be honest, I'm not gonna pay any more money to the hospital because I already paid too much anyway. So I'm just gonna go. And I said, I think I might just remove them myself. And they said, that makes sense because that was so much money. So we'll just take you off triage. It'll be like you're never here. Don't worry about it. And then they were like, you know what? Don't tell anybody we gave you this. And they gave me a little kit to remove my stitches myself. So that's a little story about healthcare in America. $1,800 will get you 5 stitches, and then nurses have to go behind the backs of the hospital to get you treated. So that's pretty stupid.
Want to see what happens when you find out the average ambulance bill is $1,200 without insurance, $600 with? He's off, ladies and gentlemen. He is refusing an ambulance ride because of the cost. The problem in America is that our medical costs are so high that without insurance or minimal insurance, you can go broke paying your bills. This is a gentleman who had a shark attached to his arm, and he's refusing medical care because he's worried about the costs. This is a big problem. People are not getting the care they need because they're worried about the cost. And why are things so expensive? Well, one of the main reasons is the ongoing fight between insurance companies and the hospitals. Hospitals will often decide on the price of things, and insurance companies only want to pay a small percentage of it. So let's say a hospital says, we're going to charge $1 for Tylenol. Well, the insurance company may only want to pay 20 cents. The hospital says, well, we need to make more of a profit to keep our business running. So then they charge $2 for a Tylenol. And again, the insurance company is like, well, maybe we're only going to pay 40 cents. And before you know it, after this back and forth, hospitals have raised the price of one Tylenol to $500. And then you come along with minimal insurance or no insurance and show up at the hospital, and they say that'll be $500 for that Tylenol. And that's the problem. It's the ongoing fight between insurance companies and the hospital, and unfortunately patients are getting stuck in between, and it just has to change.
If you've been following me, you know that I spent 2 days in the hospital about a month ago for a rare nerve disease called trigeminal neuralgia, and I got the itemized receipt today. Let's add this up. General Pharmacy, $4.70. When they drew my blood, $511. The ER visit alone, $2,299. To get my MRI that they actually messed up, $7,452. All the drugs they gave me, $177.95. Here's a list of all of them. They charged me a little over $2 right here for ondansetron, if that's how you say it, because I was nauseous. So there's a list of this is a small list of some of the drugs that they gave me. Special services here for $6,298 because they had to bring a neurology team in. Other therapeutic services, which I did the itemized on that, and that was for observation because it's a rare disease, and for the grand total, $18,870.62 for 2 days in the hospital. So if you want to live in America, just know it's going to cost you 2 eyeballs on the black market.
Strange it is that when you get a healthcare service in America, you don't know how much it's going to cost. You just get a bill.
So I want to talk about one of the downfalls of being a chronically ill doctor. I worry every day that knowing this, and not just knowing it like, yes, I know that America has become cost prohibited for most sick people, especially the chronically ill. But what I truly worry about is that I have experienced this myself. And now when I try to order tests or when I try to order treatments for my patients, I get anxious about it because I don't know how much it's going to cost that person. If that person is going to even be able to afford it. And I worry that anxiety that I experience will lead me to not do what's best for my patient. And I know people will come on here and probably comment about this and say, well, you just got to do whatever's best for that patient, and not worry about the cost. Fuck off. Fuck off. That is worse than just dealing with it and taking a risk of possibly dying. Because I have had the wind knocked out of me when I have opened a hospital bill. I have sat there in disbelief going, how could it cost this much? And I experience that when I go to order tests for my patient or medications for my patient or anything for my patient. I experience that, and it makes me worry that it is going to affect how I practice medicine. I've said it before, and I'll say it a million times. Our current healthcare system is fucking disgusting. It is, there's no period in the sentence. It is fucking disgusting what we do here in America. And it needs to change from top to bottom. It does not work. It doesn't. It saves a few. It hurts way more. Anyway, have a great day. Bye.
Your medication, the side effects are worse than the actual symptoms.
Yes, thank you.
Ignorance.
Thank you. I think I found the cure to
Good
cancer.
job. Unfortunately, we will have to kill you.
Wait, what?
Bye-bye.
I had a heart attack yesterday.
Sorry, but you're a black woman. You're probably fine.
Huh?
Hey, you. Here's some antibiotics. These will permanently damage you. Come back next week for more.
You're the doctor.
So why is healthcare so expensive? Because it's so complicated. You have to look for in-network physicians, schedule an established care appointment, beg for coverage from your insurance company that couldn't care less about you, and that's if you're lucky enough to have good insurance. Compare that to Britain and all of those other evil, socialist-like countries where it's simple. Public hospitals provide free treatment to people who need it. That's it. I'll repeat that. Public hospitals provide free treatment to people who need it. And here's the best part. Even though Britain offers healthcare for free, their system is actually a lot cheaper to run than ours. Per capita healthcare spending in the US is almost 3 times what it is in Britain, and almost 5 times what Canadians spend. In fact, Americans spend the most per person of any country in the world for healthcare. But the free market is more efficient, you screech. But in America, private systems often aren't efficient at all. Private drug companies have an incentive to charge whatever they can get away with for pharmaceuticals. In Canada, a carton of insulin costs about $20. In the US, it costs $300. And with private insurance companies footing the bill, hospitals have an incentive to get as much money out of patients as possible too.
On the bottom, Paige, you were good. I'm waiting for you to be great. And next, Kendall. You didn't stick out to me. Next is Brooke. Next, Nia. You're third on the pyramid. You were third overall high score. And Mackenzie. And on top of the pyramid, going 3 for 3, once again, is Maddie.
Cost of healthcare in America has ballooned over the last 20, 30 years, and it's not because doctors cost more to the system. Healthcare has skyrocketed because for every doctor, you need like 10 to 15 administrators. It's literally a disaster.
Is there a solution?
No.
I mean, no, there's no.
Well, some people will say universal healthcare is the solution.
Yeah.
There's no one-size-fits-all answer because some people will say, well, universal healthcare isn't free healthcare. It's still paid by somebody. It's paid by us, the taxpayers. And if we're being honest, whatever the government does usually isn't the most effective or efficient way of doing things.
I want to clarify one of the biggest misunderstandings about the high cost of healthcare. Too many people think that someone else is paying for their healthcare. They might think that a health insurance company is paying for their health care, but actually a health insurance company is just a middleman. All they do is manage the money that gets allocated to them in the form of premiums and then pay those costs out of the premiums that you and I and others have already paid. Some people think the government pays because there's Medicare, there's Medicaid, there's all these other government health plans, there's subsidies for individual insurance. But you know what? All that government money is taxpayer money. That's coming from you and me too. And then some people might think their employers are paying for their health care, but actually employers are paying for health care out of the compensation of their employees. So we're thankful that employers fund our compensation, but it's employee compensation that's funding health care. So never forget, every dollar that funds the more than $4 trillion in our healthcare system is coming from the public. It's coming from people like you and me. And when we overspend that money, those costs are going to keep going higher and higher and higher year after year. So we need to stand up. We need to push back. I'm showing you exactly how to do that in my book, in my videos, in my newsletter. Check out the links, and I hope that those things can help.
If healthcare is a constitutional right, then
that's a form of communism because no country could afford those payments without seizing the assets of everybody else.
Welcome to Finland!
Oh!
Dudes, what's going on? Oh my god!
It's making me so mad.
I mean, come on, guys. It's not that hard. Look around the world. Everyone else seems to have figured it out, right? Imagine you're in America. Which of these options would be best for you?
That's a lot to think about.
What is an OOP max?
I guess with what I got here, I would go with Plan D because the deductible is 0.
Okay, there's more.
Gold, HMO, PPO, HMO.
And what are copays? I don't get... That's like if you pay for Spotify Premium and Spotify still makes you pay every time you listen to a song.
It's too complicated.
I'm lost. I'm so lost.
In Canada, I don't have to really think about the different plans that I could pick from.
You just pay one amount per month and all the major treatments are covered.
At least 70% of our medical expenses are always covered.
Uninsured, unable to afford treatment for a tooth infection that keeps flaring up. Cook Emma Rittner lost her job in March.
I did manage to get antibiotics from a friend whose mom regularly goes down to Mexico, and I've been taking that, self-medicating, based off of Dr. Google's advice.
Dr. Google's advice.
Here in Japan, even if you lose a job, you would never lose your health insurance.
When you lose your job, that's when society should help you.
I've chosen a creative job and had the backing of a healthcare system. But if you don't have that, do you pick the safe job or do you pick the creative job?
The average price per unit for insulin in 2018.
Germany, $11.
Canada's $12. Wow. It's like 8 times the price of insulin in Canada. I guess that explains why Americans come up to Canada to buy medication.
I'm sorry, hold on. So the FDA doesn't have any authority over the prices?
We have also privatized health insurance companies in Germany, but the prices are regulated by the government.
The government negotiates the prices and fixes that price for 2 years.
In Singapore, they regulate this stuff to keep the prices down and, avoid like this happening.
Right, so I'm looking at an American medical bill.
Why is it so expensive?
$428,000 for rooms and such empty spaces. What?
Much cheaper to go Hilton Hotel than this one.
Skin to skin after C-section is $39.
I had to pay $39.35 to hold my baby after he was born. You need to pay money to hold a baby?
My brother Jamie, who's in a lot of our videos, was pretty badly injured. He's going to lose a couple fingers. If you can give $1 or if you can give $5, every little bit will help him and his family.
That's heartbreaking.
GoFundMe should not be something that people have to resort to pay for their medical bills.
So in America, people spend more than twice as much as in Japan for healthcare.
If I paid twice the amount for a car, I would want the car to be twice as good.
So what's the life expectancy in the US?
Why is it less?
The US should be on top of both of those lists. Like, if you're charging your citizens that much money, then they better be living the longest lives. It doesn't make sense.
When Alec turned 26, he was no longer allowed on his mother's insurance plan. Instead, he decided to pay for his insulin over the counter at list price. But the pharmacist told him a month's supply would be $1,300. He left empty-handed. Alec's official cause of death was diabetic ketoacidosis.
A couple of years ago, I developed a heart condition, and I had to have my heart restarted 3 times. After the 3rd time I had it restarted, the doctor suggested I get heart surgery.
When I was 13, I started to get sick and really, really sick. I was then very quickly admitted into hospital, where after 3 weeks I had treatment for a brain virus.
The cost of the operation, I think, is about $60,000. And then the next day, when I left the hospital and I got my bill, it was a bill for parking. It was about $30.
I was treated by royal doctors, had several MRIs, lumbar punctures, all for free.
So I was pretty happy that I lived in Canada and had universal health care.
I couldn't have survived if I was in America.
To know that I can get sick, I can get injured, but I will still be taken care of. That is freedom. This is not freedom.
This is how messed up healthcare is in America. You actually get treated differently depending on the kind of insurance that you have. Let's say you have breast cancer, for example. So we take out the cancer, we take out the breast, and then if you have really good insurance, we're going to offer you what's called DIEP flap. And that is a surgery of how we reconstruct the breast. It's a relatively complex procedure where we take fat and skin from your abdomen and implant it into your breast. And of course we morph it to make sure it's even and symmetrical. Both breasts look pretty similar, but it's your own native tissue. And if you don't have great insurance, but you have okay insurance, we're going to offer you breast implants for reconstruction. And there's nothing wrong with that, but it's a foreign body in your body. There's issues with that, and not everybody wants that. And if you don't have any insurance, we just take out the breast, take out the cancer, and we just sew you up, and it looks kind of like this.
In my mind, insert cash.
or select payment type. Use PIN pad to complete transaction.
America is so fucked up. I just got back from my 2 months Europe trip and all these smell. You know what that is? I twisted my knee from snowboarding. I went to the doctor, talked to him for 2 seconds. After insurance, $186.99. I went to the dentist. Also didn't do anything. My teeth were fine. It was only a checkup. $1,144. After insurance, I have to pay $400 myself. This is the craziest one. My period was lasting for over a month. During that time, I went to get it checked up and she didn't figure out anything. I did an ultrasound. She said insurance should cover everything. After insurance, I'm paying $754. That's after insurance. I'm never going to the doctor anymore. What's the point of having insurance? I'm paying so much to the insurance company like every month already. And I still have to pay all of these myself?
Fresh trim, grey tracky, grey tracky. She loves a gun, man, I stay tracky. I wore the black night test, she told me change it to the grey.
Bae, I love it when the dick's on display.
For those of you that don't understand how truly awful the US has become, I'm gonna put it into perspective for you. I saw my aunt yesterday and she told me a story that absolutely blew my mind. And it's really hard to tell me a story about the evil that America is right now that surprises me. But this surprised me. It's on another level. So my aunt is a realtor and she had a client in the past that she sold a second farm to. He is a farmer and he raises cattle, making an honest living, and so his original farm wasn't big enough for all of his cattle, so he had to get a second farm. And then his wife got pregnant and then a medical emergency happened. So basically the baby was born extremely prematurely and the wife almost died, but that's a separate issue. And so I want you to guess. I want you to formulate a number in your head about how much you think it cost for that baby to be in the hospital for 4 months because it was a premature baby. Take a minute, think about it. $900,000. Almost $1 million. What small-time, small business owner, farmer has $1 million? So now he has to sell his second farm, he has to sell some of those cattle, and for what? So his baby could survive. America, right? So pro-life, huh? The more that I learn about getting services done abroad, about health tourism, medical, dental, wellness, beauty tourism, the more I'm like, why haven't I done this sooner? These procedures that cost tens of thousands of dollars in the United States sometimes only cost a few grand abroad. So I looked it up. The average American spends like $13,000 a year on health expenses. If we took that money we spend each year on health expenses in the US and put it towards getting those same services done abroad, we could take like 3 to 4 amazing vacations a year while we are there without spending more money each year than we normally do. And so many Americans already do this. I learned that 150,000 to 320,000 Americans each year travel overseas for medical care. We all should just do this because they are taking advantage of us.
I'm supposed to get a mammogram and a bilateral ultrasound on my boobs because there's a lump in there. And the lady called me and she's like, do you know how much it's gonna cost? Like, she told me. I was like, no, I didn't know I had to pay. And she's like, yeah, it's gonna be $801. And I was like, you can cancel the appointment. I'd rather die. And she said, no, you can do a payment plan. So I called the payment plan people and they were like, if you do a payment plan, we're gonna charge you $232 for 4 months. So that goes up to $930. So almost $1,000 to get these 2 tests done. And I said, okay, thank you. I'm gonna cancel it again. So I called the doctor in Tijuana, Mexico, and he was like, yeah, for mammograms, I charge $189. It would be cheaper for me to book a flight tomorrow to Mexico for like $400, get a mammogram for $189 and come back, then drive down the street and get a mammogram in Texas.
That's where a rattlesnake bit my mom 2 nights ago. We're Canadians visiting here in Arizona, so we rush her to the hospital and they say she's going to need this antivenom that costs $2,600 US per vial, and she'll need 3 vials. Then when they discharge her, they let her know that they've given her 10. Without her consent, $26,000 US. Not to mention they kept her overnight for observation, couldn't find a bed or a room for her, so she had to just stay on a gurney. It was a whole other story. But who knows what the final bill came to, because luckily she has insurance coverage. But why would any American not want universal health care? When we're in Canada, we don't have to worry about this kind of thing. Not because we don't have rattlesnakes, but any kind of issue, you just go to the hospital and it's taken care of. Here, if you don't have insurance, are you going to pay that kind of bill? Why isn't everybody in America demanding universal health care?
$153,000 rattlesnake bite? That's how much it's going to cost you in the US at a minimum these days. This is a gentleman who actually presented his bill, $153,000 with $83,000 just from the pharmacy alone. And that's not even the highest one on record. Recently, a woman had a $400,000 hospital bill after her own snake bite. So why is the cost of a snake bite so high, at least in the US? Well, it has to do with the antivenom medication that you're given when you get to the hospital in order to save your life. In order to make the antivenom, they have to get the venom from the snake, inject it into a horse who makes immunoglobulins, and then they extract that and then create the antivenom. And you may have to get multiple vials of this antivenom in order to save your life after you're bitten by a poisonous snake. And even though it may only cost about $14 to make this antivenom, they charge the hospitals a 70% markup, and they add in fees that they had to pay to the FDA to get approval. So for a $14 antivenom, they actually charge about $3,200 per vial. And patients may need 10 vials or more to save their life. So while in the US, the charge might be $3,200 per vial, in other countries like India, it's only about $6 US. Fortunately, antivenom is generally covered by insurance in the US, but without insurance, you might be facing a bill in the hundreds of thousands of dollars. Do you think this markup is fair? $6 in India versus $3,200 in the US, 500% price increase.
This is healthcare in America. So I got this bill that charged me $425 for a follow-up visit. And I was like, that's definitely wrong, because this code, you have to look up the codes of charges in the United States healthcare system. This code that they have on here is for an in-office follow-up visit. But my visit was a telehealth visit, and it wasn't with my specialist. So instead of being $425, this should be way closer to like $200. So I called the doctor's billing office and was like, hey, you billed me incorrectly. And they were like, oh, you're going to need to talk to the doctor who issued that code, because like they just put it in the system and then we issued the bill. And I was like, okay, well, can we put a pause on this bill? Like, can you not charge me until I figure this out? And they were like, oh, well, you're going to have to talk to our collections officer. And I said, can you transfer me to the collections officer? And they said no, because in this office, they don't have any direct lines to each other. And I just think this is a perfect depiction of how fucked healthcare is in the US.
I'm crying in my car outside of CVS because the pharmacist just explained to me that the reason my medication is so much more expensive this year than last year is because at first the medication company keeps the price low to get you in the door and get you hooked. Exact quotes, her words, not mine. And I said back to her, this is not a Starbucks. If I don't take this medication, I can't shit. And if I can't shit, then I throw up everything I try to eat because there's no room for it in my body. And then I slowly starve to death. And we tried all the other options, and this is like the last thing on the list. And my insurance won't cover it. I've sent them letters. I've called them. Fuck you, Aetna. And the medication company was making it only $35 a month for me with a little coupon, which was great. But then this year, the coupon only brings it down to $300. They increased the price times 10 so they can make money off of my need to stay alive. Fuck you. Oh my God. Oh.
I've been reflecting a lot on my series about how the world views the US, and one of the main themes that I keep hearing over and over again is that people all around the world recognize that the American healthcare system is broken. Let me give you my own personal insight into what this looks like. I had to get new health insurance last year, and I scheduled an appointment with a new doctor because I had to get all new doctors. I scheduled an appointment with a new doctor in March of this year. And that appointment got canceled and rescheduled to July of this year. And that appointment got canceled and rescheduled to August. And today I learned that appointment got canceled and rescheduled till October. So if you're counting, that's 7 months. That's 7 months that I have to wait to see a doctor. I can afford to pay out of pocket. Not everybody can. Many Americans think socialized medicine is a joke. Tell me what you think.
You know how the argument for universal health care is that people in other countries have to wait months and months to see a doctor? The argument that it's worth it to pay hundreds of dollars a month for insurance so that you can actually get seen and get care and not die while waiting? Well, a little over a month ago, I woke up thinking I was having a heart attack, but I was taking care of a sick animal and afraid of the hospital bill, so I just waited. It went away. Well, it kept coming back, and eventually I went to the ER and discovered that I have something wrong with my stomach. I had an expensive CAT scan. The ER, which already knew my insurance information, gave me a referral and was like, call this place, they should be able to get you in quickly because we're an ER referral for a gastroscope. I call that place and they're like, oh, well, we actually can't get you in for another 3 weeks, and also we don't take your insurance. Wow, what a waste of 3 days. Then life happened, my dog passed away. The medication they gave me fixed the problem temporarily, but I still don't know what the issue is. I need a camera down there. Finally, after doing all this research to find out who takes my insurance, I schedule an appointment with a gastroenterologist. Of course, that doctor is part of a bigger health network, and the person on the phone is like, we can get you in 3 weeks. And I'm like, okay, can we preemptively schedule the actual scope since the doctor needs to meet me first and bill for that initial meeting, and it's already going to be number a week. They say, no, you have to first meet the doctor, where basically I say, hey, here's my ER paperwork, I need a scope, other doctors have already determined it. He can go ahead and issue the bill, and then finally schedule a scope, which often takes a number of weeks to schedule. They gave me 3 months of medication, and I think now I know why. Because they knew it was probably going to take ER and then 90 days before I actually get a camera down there to figure out what my problem is. And you know what? If it's something significant like cancer, oops, I just lost 3 months of time. Oops, an ER referral means nothing. Oops, I waited a long time to figure this out, and it actually maybe makes my health worse, which is the argument for all these other countries that have universal health care, except instead, I don't have universal health care. I'm afraid to go to the doctor. I never know what my bill is, and I've already paid thousands and tens of thousands of dollars into insurance over my lifetime. America.